everyone. Thank you for being here. This is another live session with Dr. Jeff. Hi, Dr.
Hey guys.
Jeff.
Hey Lily, how are you doing?
Good.
We're here in the studio.
Yes. And if you have any questions, post it here. We also have some of your questions from Instagram. And regarding BBL, and this is from Miss Coco, regarding BBL, is it normal to lose a lot of fat?
Is it normal to lose a lot of fat following BBL? It's normal to lose 30%. All right, so everyone loses roughly 30%. So it is a decent amount. But the good news is you keep about 70%. And in most cases, that's really enough. And usually we overcorrect a bit.
Yeah.
All right, so we ask if somebody wants to be more natural or a little bit more dramatic or where they want to be, down the road. We make accommodations during the procedure to account for that.
Yeah.
But everyone is going to lose about 30% of the fat that's transferred. That's a good question.
That I always like to tell them that never ask for natural.
Never ask for natural.
Because you're always gonna lose some.
But you have to think that even if they want to be natural, they're still going to do a little bit more, so then when it settles out, it would have more of a natural appearance. But somebody wants to be a bit dramatic, it's going to be very dramatic initially, and then when it settles out, it'll be a bit on the dramatic side.
Let's see. Oh, thank you everyone for joining. And we have Miss Coco. We just answered your question. Okay, so how many times, this is from Tina24, how many times do you need to be seen post-op or after surgery?
Oh, like is it 47 or 48 or so? So we see you usually the day after. We see you several times while you're still here. If you're local, we see you, down the road as well. If you're not local, we've many patients who fly in for different procedures. So we see you in town, and we also see you by virtual, either by video or by phone. So whatever's necessary, that's what we do. We see you a number of times following surgery for sure.
So one thing that you might know is like your post-op visit after surgery, that one is mandatory, right?
Mandatory, right.
Mandatory is the right word?
Right, mandatory is a good word. So that's usually the next day, but people who are staying a little bit longer, like the tummy tuck or so, we're going to see them once or twice more beyond that before they leave.
And one thing that you also have to know is like we have the med spa here, and we have a great team of nurse practitioners and nurses also, so you can actually come every day if you want after surgery, every day.
You can just move in.
Exactly. We have beds.
Yeah, beds.
Okay, so do you do J plasma? And this is from 207 Burgess.
Every day. So we do that. We do that every day. For the right patient, it's a very good technique. I've been doing it for maybe 4 years or so, now maybe 4.5 years or so at this point. And it's radio frequency energy, and its single purpose is skin tightening. Okay, so if you've got a little bit of laxity, a little bit of looseness, it can do a very nice job of tightening that. If you've got very thick, very significantly loose tissue, very loose skin, you need to remove them, whether it's a tummy tuck or an arm lift, brachioplasty, that sort of thing. So we just have to give it, the appropriate amount of respect in the sense that it can accomplish a number of things, but it can't accomplish the impossible. But it's a great technique for the right patients.
Doctor, for the people that doesn't know what is J plasma, can you briefly explain?
Yeah, so that's actually radio frequency energy. So it's not laser energy, but it is a form of energy that results in, it's kind of a variation of the heat energy.
Oh, okay.
So it's not dangerous. It doesn't have the complications that are associated with straight lasers often. And so it's really a harmless technology, as I find it. And to see the result, it really takes about 6 months to see the final result after using J plasma.
We have a very interesting question here. What is the least amount of fat can you get for a BBL?
One cell. Be one cell, be the least. What's the least amount that you can get? So it depends, right? It depends on your goals, depends on where you're starting.
I guess, that sounds like it's a skinny person probably.
Exactly.
Asking.
No, exactly. I'm just messing with them.
She's like, with how much can I fill out
this?
Well,
even like 300, well, the hip dips can take like 150 cc's to fill that. Depends on the patient, obviously, but with a thinner patient, more of the skinny BBL, sometimes we'll transfer even 300 or 400 cc's per side and have a great result. So it's really not how much you're using, it's how you're positioning that. And you mentioned the hips. So for those depressed areas, those hip dip areas, usually about 150 to 200 cc's is plenty for each side.
Yeah.
So you don't need a huge amount. And depending on the patient, it might even be 100 or 150 cc's. And then for the buttock region, it might even be 300 or 350 cc's.
Correct.
But for somebody who, is larger, wants more fullness, it might be 1,000 cc's or 12, that sort of thing. But they're asking me, what's the smallest amount? I say the smallest amount, realistically, for the hips and the buttock region, it could be 300 to 400 cc's per side.
Okay. Interesting. And if you, of course, if you want to have a consultation with Dr. Jeff, just send me your name and your phone number. You can do a screenshot of this so we can schedule like a video call, like a video consultation.
That was a smart question. Because often they'll ask, what's the most
Yes.
you can transfer with? She's
Yes.
asking, what's the least?
Yes.
Obviously, she doesn't have a huge amount to
Exactly.
use, but we can still make a real nice difference even with a small amount of fat transfer.
Yeah. And you might be surprised because sometimes, you know, I've seen like skinny patients and then it's like, okay, the way they have
The
the fat
construct, right.
sturge or something, you might
Exactly.
be surprised. Okay, what other question we have here? How long, and this is from Juju, B10, how long do I have to wait after my tummy tuck to get a BBL and a breast augmentation?
That's a great question.
Mm-hmm.
So typically, you know, I will ask to wait about between 6 and 12 weeks.
Mm-hmm.
Or it's like a month and a half to 3 months, depending on the situation. All right. So if there are no other medical issues, you've recovered well from the first procedure, you can do the next in as little as 6 weeks. All right. So it's provided your blood work is fine, your hemoglobin is up, and all these other parameters are normal. If that's the case, we can proceed as early as really 6 weeks to 12 weeks.
Okay, that sounds like 6 weeks to 12 weeks. That's like
A month and a half to 3 months.
a month and a half to 3 months.
Right, that's what I said.
Uh-huh.
Right, exactly. But some people think you have to wait 6 months or longer. You don't. Okay, but there's a logic to some of these different waiting periods. For instance, if you did a BBL and some people just want, you know, have another BBL and, you know, have additional fullness, that sort of thing, a second round, we don't want to rush in at 6 weeks, right? Because of the question we just answered a few minutes ago, 30% is going to resort, but we don't really know
Correct.
exactly how much.
Exactly.
Okay, and exactly where. But at about 6 months, for me, I consider that time frame to be sufficient to determine, like, yeah, now we know where we are. All right, we know how much has resorbed and what areas really need, you know, the most attention. Because to go right in, you know, a week later, we would just have swelling. If we were to go in, you know, too soon, we'd have a lot of swelling. We wouldn't really
Yes.
see where we're working. You know, so
Yeah.
it wouldn't make sense to do that. So for BBL, I would wait a solid 6 months.
Correct.
But otherwise, for most other procedures, I'd say 6 to 12 weeks would be fine.
Hi, Quita Willie.
Hey there.
How long, Astrid Mila, how long does surgery take, BBL and Lipo 360?
So that takes us about 2 hours. So for me, for you, about 5 minutes, right? You'll be taking a nap. So typically about 2 hours.
Yeah. Do you do Mons lifts?
Yeah, of course.
Yes.
So that's done with a low incision, similar to a tummy tuck incision. It can be done in conjunction with a tummy tuck or a mini tummy tuck or by itself.
Very interesting question here from Cuban Abby 21. Is Cell Saver safe? And what's the chance my hemoglobin will stay up if I use it?
All right. So the Cell Saver is completely safe. All right. So technology has been used for decades. All right. So it's 100% safe. There's no possibility of getting anybody else's blood because it's only you in the room with the device. Totally safe, totally effective.
Yes.
And in cases where there might be a little more bleeding than we like, you know, we'll use that to capture the extra blood, filter it, and transfer it right back in through the IV into your body. Will the hemoglobin stay up?
This is a procedure especially for the people that are self-sufficient.
That are self-sufficient, right? So if we think your hemoglobin is drifting down a little bit, we'll use the Cell Saver to bring that back up again. But keep in mind, everyone drops their hemoglobin with surgery 100% of the time. So there's a little bit of bleeding at least, plus you get a lot of fluid during the surgery and right after the surgery. And that's what we call hemodilution. So your blood is just being diluted, which is normal, you know. But as far as keeping the number up, it definitely does increase because you're getting a little boost of hemoglobin from the red cells that were transferring that.
Yeah.
Sure. That's the
But it
purpose of
doesn't
it.
mean that you're gonna come out of surgery with your hemoglobin.
Right. You're not going to come in at like 13 and leave at 20.
Exactly.
Right. So it's not a transfusion. It's an auto transfusion.
Exactly.
So we're giving you back, you know, some of what you lost.
Yeah.
All right. But we're not supplementing. It's not a transfusion.
Yeah.
In that regard.
Yeah. So I hope that answered your question, Cuban Abby. I did a paniculectomy. Can I do Lipo 360, Bella 20?
Of course. So
What is that?
paniculectomy is basically just removing this lower, like, apron of
Oh,
tissue. So
okay.
it's not repairing the muscle. You're not going this high. You're really staying
Oh.
low. And some people just have a lot of redundant skin, and it can cause rashes and cause all sorts of problems. So all this lower tissue, like way below the belly button and hanging down, is just
Oh,
removed, and we call that a
interesting.
PANIS, we call it a paniculectomy.
Oh, I didn't know
And
that.
sometimes
doctor.
we'll have patients, you learn something, right?
Yeah.
We'll have patients who have a paniculectomy done, somewhere else, then they come here for a more formal tummy tuck abdominoplasty procedure where we repair the muscle as well. Can you do a lipo 360? That was the question. Of course, absolutely.
And it
Yeah.
will definitely
Will be beneficial.
Yeah, beneficial for your. Cuban Abby, if I get a tummy tuck with regular lipo plus back lipo, is that almost the same as a lipo 360?
It is the same as a lipo 360 with a tummy tuck, right? So,
Yeah.
so she's talking. We're doing the flanks, the upper abdomen with every tummy tuck that I do, and then adding the back gives us that 360 effect.
Correct.
So that's a good question. So that
Yeah.
would be 360 and the tummy tuck combined.
Exactly. Thank you, doctor, they said.
All right, my pleasure.
Hey, this is Crystal, C-Bomb Shelf.
Hey there.
You left her like super hot. She's super beautiful. Hello, my favorite people. See you again soon in August, Dr.
Okay.
Jeff.
All right, I'll be here.
Oh my God, she's amazing. Follow her. She has a
Yeah.
great result. Yes, I did it with my insurance, the panelectomy. Okay. Oh, nice. Do you do back lifts and how much? Well,
We
Bella,
do.
for that
We
price,
do for the procedure, to be honest, all right, because there can be complications associated with it. You're laying, you have to keep that area protected so that it doesn't open. But more than that, aside the surgery is really not a difficult procedure. It's the expectations that can be difficult in the sense that some patients have. Actually, I'm going to spin you around for a second. Either way, some people have issues up here on the upper back, right? And some people have issues lower down. So people think that if we make the incision low, we're just going to bring it down like pulling, like a bed sheet, and smooth it all out. So you're not ironing the back. And for people who have these folds.